Caring for people in the last days of life is unique and humbling privilege. It's our responsibility to deliver the highest standards of care to patients and their loved ones during the last days and hours of life and after death. Care for the dying is grounded in 5 priorities: recognise, communicate, involve, support, plan and do. The SWAN model of care builds on these 5 priorities to support and guide a consistent standard of care for patients. SWAN is an acronym for
Signs and symptoms that indicate a person may be dying. It is about timely recognition of changes in a person's condition that means we believe a person could be in the last days and hours of life.
Words. Use must be clear, sensitive and unambiguous, and deliver consistent, honest and sensitive communication that is person and family focused.
Actions must be taken to involve the patient to meet individual wishes and preferences for care. It's about listening to what really matters to a person when time is short and involving them in decision making.
And needs of the patient and those important to them should be actively sought, regularly monitored and documented in an individual plan of care, ensuring that those needs are respected and met as far as possible.
Death and dying is everybody's business. We all have a role to play, and the SWAN model of care helps us to build on the fantastic work we already do to look after our patients and their loved ones during the last days and hours of life and after death. The model supports and guides us so we all feel empowered to deliver excellent care for every patient and every family every time.
SWAN is thinking outside the box and having permission to act to meet the unique needs of each individual and their loved ones.
This may be offering the patient their favourite foods and drinks for comfort, offering open visiting, free parking or regular cups of tea to relatives.
Or even planning a hospital wedding or facilitating for the family doctor visit.
SWAN is walking alongside patients and all those important to them, and offering a listening ear to all ages regardless of faith and belief, and offering spiritual and religious information and resources for our wards.
Offering access to specialist volunteers who can provide one-to-one companionship and support to patients at the bedside in the last days and hours of their lives and their loved ones.
Creating memory making and offering sensitive mementos to meet the individual wishes and needs of the patient and those important to them.
And providing consistent and standardised education and resources so staff can feel really well equipped and informed to deliver excellent care to patients and their loved ones during the last days and hours of life and after death.
SWAN is ensuring dignity and compassion at all times.
By being respectful and mindful of maintaining a quiet and peaceful environment wherever possible, whenever we see the SWAN symbol.
It's about going the extra mile and paying attention to the little things that can have a big impact.
In all care, in bereavement and after death too,
ensuring that loved ones are offered timely support and information.
Stockport is proud to apply the philosophy of SWAN as a core standard so patients and loved ones can be assured that they will consistently receive the very best care in every one of our hospital areas. The SWAN model of care is part of our trust commitment to prioritise the delivery of excellent, compassionate, dignified and individualised care at this difficult time. Thank you to each and every one of you.
Making a difference every day.